and then let's talk syphilis for a little while. So this is syphilis nationally, and they're looking at the primary and secondary syphilis cases, so still early on in the progression of the disease. In 2008, there were about 13,500 reported cases of primary and secondary syphilis in the United States. This is the highest number since '95, and there's been an increase since 2007. One thing that's interesting that I found out when researching this is around the year 2001, and it looked like syphilis was going away. The US rates were super, super low, but they were seeing a slight increase in some metropolitan areas, including San Francisco. And since then, it's really just been on the rise. So we looked like we had been getting pretty far away from syphilis, and now it's definitely coming back. So definitely nationwide, men who have sex with men are disproportionately affected. Heterosexual men and women, which includes all women, slightly less for sure, but definitely men who have sex with men are the most affected by syphilis. And you'll find that's true for San Francisco as well. So the number of reported primary and secondary syphilis cases in 2008 that we had was 342. So we had 342 cases, and we had 13,500 overall in the United States. So San Francisco accounts for a pretty significant number of syphilis cases in the US. Our early syphilis rate is 70.6 per 100,000 residents, so lower than chlamydia, lower than gonorrhea, but definitely still pretty prevalent. From 2008 till 2007, there was a 55.8% increase in early syphilis in San Francisco, so that's up really significantly. And then our increase in the primary and secondary syphilis rate was 67.3%. So really significant increases between 2007 and 2008 in San Francisco syphilis cases. And that was one of the largest increases that we've seen. We had actually a pretty steady decline and then really rose up rapidly. In San Francisco, 90% of early syphilis occurs in men who have sex with men. San Francisco City Clinic diagnosed about a quarter of those cases, private medical doctors another quarter, private hospitals about another quarter. One thing that we can say is that San Francisco has lower rates than Los Angeles and New York, but we definitely exceed the national average. All right, so this is what syphilis looks like in San Francisco. This top bar is gay and bi men, so men who have sex with men. These are their cases. You'll see it's around 90%. Other men, so these are going to include heterosexual men, and they might include men who don't necessarily identify as gay or bi, so this is taking self-report on identification. They account for a small number of cases. Women in 2004, 0 cases. I think in 2005, 1 case. 2006, no cases. 2007, oh my god, that was our really rampant year. It was like 4 cases. 2008, 1 or 2 cases. So really not that many people, other than men who have sex with men, are getting syphilis in San Francisco. This is why this is hard for you to get this test. And then looking at San Francisco versus the other metropolitan statistical areas, looking down here, primary and secondary syphilis, San Francisco is relatively high. Early syphilis, most other cities a little higher than we are. But our total syphilis rate in New York and LA have a lot more syphilis than San Francisco does, but we do have more than the national average and a little bit more than California's average. All right, and we'll take a look at this one as well. So syphilis by age and gender. Once again, we see a lot of syphilis cases. They're almost entirely in men, and they're a little bit older as well. So early 40s tends to be where the peak is with syphilis cases in San Francisco. So if you are a man who has sex with men in San Francisco, this is why you're going to get a syphilis test. This is why you're recommended to get one every 3 to 6 months, because this is really the population that's hit by it. All right, this is not super easy to see. I apologize for it. So every month, the San Francisco Department of Public Health puts out my favorite toy, which is the monthly STD report. And it'll tell you from this year how many cases were diagnosed and how many it is compared to last year. So this is comparing December of 2009 to December of 2008. And we definitely had a decrease in gonorrhea cases of about 200. Chlamydia stayed pretty stable. Syphilis stayed pretty stable. PID stayed pretty stable. Adult male shigellosis, which is a really fun bowel disease, definitely increased a lot in 2009 over 2008. In terms of HIV testing in San Francisco, they're only talking about city clinic patients, so there's only one clinic that does testing. How many people are showing up positive from 2008 to 2009? So in all of 2008, they had 98 people who tested who showed up positive. In 2009, they had 89 people who tested positive. The total number of tests really decreased, and this can be because they're starting to get more stringent about who can get tested there. So in 2008, they did a little over 5,000 tests. 2009, a little over 4,000 tests. seeing fewer people getting tested, but still a pretty stable number of people who are showing up antibody positive. Right, and the last thing that I had was late-breaking news that I found, just found this today when I was doing research for this, is acyclovir, which is an antiviral drug that is often used in herpes treatment, can slow the progression of HIV. So this was just reported in the Lancet today. They did a study in Africa that was looking at people who were co-infected with HSV2 and HIV1. So HIV comes in a couple of different varieties as well. HIV1 is actually a little more rare in Africa where the study was taking place, so a little bit harder to recruit people for it, but they did manage to get a fair number of participants. What they did is gave these participants 400 milligrams of acyclovir per mouth, and they had to take them twice a day, so a total of 800 milligrams a day. And it reduced the risk of HSV1 or HIV1 disease progression by 16%. And so what they mean by progression is the number of CD4 cells that you have. They were counting that, the number of cells per microliter of blood. So the people who were in the study, when they were taking acyclovir, definitely reduced the chance that they were going to fall below the threshold of 200 cells per microliter, which is great. And it also delayed the risk of their counts falling below 350 cells by 19%. So this seems to be keeping people healthier for longer. They are considering this to be an option for early treatment, so someone who is not yet at the point where they're diagnosed with having AIDS, but they are HIV positive and they want to just remain in an HIV positive area and not fall into the AIDS category. This seems to be an option that they could go on. So that way they're not going on the heavy-duty antivirals that they want to save for when they are diagnosed HIV positive, as opposed to just, or when they're diagnosed with AIDS instead of HIV positive. So this is only one study. They're going to have to do some more research for this. It's actually a pretty exciting revelation. Something else that really sucks right now is acyclovir is having regional shortages. So some people who are trying to get acyclovir, one of the plants that manufactures it, had some kind of horrible thing happen to it. So acyclovir has been a little bit hard for people to find recently, just an FYI. So, a couple take-home messages. STDs, hey, guess what? They're not going anywhere. We still have some of them. Consider whether or not you personally like the term STI better than STD. Ask what your clients are calling them, and ask when someone says STD versus STI what they mean. Remember that some are going to be easier to prevent than others. Unfortunately, one of the ones that people tend to be very afraid of, which is herpes, seems to be the one that is among the hardest to prevent. It's going to be really hard for some people to get tested depending on what their gender is, what their partners are, and where they're trying to go get tested. So it's something to counsel your clients about and also to keep in mind for yourself when you're trying to access testing services. I have a couple of resources that I want to point you in the direction of. So I like to geek out a lot, and one of the things that I really like to read is Medscape, which is current medical news. Not all of it is STD related, but a fair amount of it is. You can sign up for a free newsletter, it comes to your inbox once a week, very handy stuff. There's this organization that has put out an STD Overview for non-clinicians. This is a free online course. It's self-paced, you can just go through this. So if you feel like you want a refresher on the actual facts of STDs, I found it pretty easy to follow along. They have some really pretty pictures, so if you want to gross yourself out, there's that. The Center for STD and HIV Training is the one who's put it out. And you can take it just whenever you feel like it. I'm not sure how long it's going to be available, so I'd recommend definitely trying to access it sooner rather than later. There's a really great clinic in the Portland area called Westover Heights Clinic, and it is run by a woman named Terry Warren, who is a nurse practitioner who also has a background in counseling and works a lot on people who are diagnosed with herpes and how to counsel them through a diagnosis and get them to a normal life again. She puts out something called the Herpes Handbook that gets updated every once in a while, and they just have a lot of great links. She's written a couple of other books as well.